Hello and welcome to the SimpleMed Respiratory Lecture Series. My name is Dr Madeleine Swannack and I am the Respiratory Lead. Today's lecture will be on the anatomy of the respiratory system. This lecture is aimed at preclinical or Phase 1 medical students and allied health professionals, and so it is pitched at that level. Our learning objectives today are to identify the various areas of the respiratory system and their function, and to be aware of the neuromuscular and neurovascular anatomy of the respiratory system and its surrounding area. The nasal cavity is divided into the left and right sides by the medial nasal septum. Air enters the nasal cavity through the nostrils, which are lined by keratinized, stratified squamous epithelium and nasal hairs to act as filters for particulates in the air. Within the nasal cavity, the epithelium changes to ciliated, pseudostratified columnar epithelium, which is the same epithelial type as the rest of the respiratory system. On the medial surface of the nasal cavity, there are three outgrowths called conchae or turbinates. They increase the surface area for inspired air to be warmed and moistened on inspiration. As well as warming and moistening inspired air, the nasal cavity is used as a resonance chamber in the production of speech and in the process of olfaction, which is smell. There are 4 paranasal sinuses located around the nasal cavity, named for the region of bone in which they are located. They are connected to the nasal cavity through small orifices called ostia. The ostia can become blocked if inflammation is present, such as in allergic reactions or infection. This can lead to the drainage of mucus from the sinuses being disrupted, causing sinusitis to develop. The 4 paranasal sinuses and where they are located can be seen in the diagram here. In the pharynx, air and food have a common passage, connecting the nasal and oral cavities to the trachea and esophagus. Both the pharynx and larynx work together to ensure food enters the esophagus and air enters the trachea. The vocal cords are found within the larynx. During the process of swallowing, the laryngeal inlet becomes narrowed. The epiglottis folds downwards, and the vocal cords adduct or move together to close off the entrance to the trachea. This helps prevent food from entering the trachea. The coughing mechanism allows particles and objects to be expelled from the trachea. In this mechanism, the vocal cords adduct, move together, allowing the intrathoracic pressure to build up, which is then followed by a quick abduction, moving apart, of the vocal cords that expels the air and particles out of the trachea in a cough. The airways are split into 2 regions, the conducting portion and the respiratory portion. The conducting portion is described as being from the nasal cavity to the terminal bronchioles and is responsible for the transport of air to the gas exchange surfaces. The respiratory portion is from the respiratory bronchioles to the alveoli and is responsible for the site of gas exchange. The trachea is lined with cartilage in a C shape, and the presence of this cartilage ensures that the trachea remains open during the negative pressure that occurs within the chest cavity during normal breathing. The cartilage is in a C shape so that food boluses can pass down the esophagus, which sits directly behind the trachea, without scraping down the cartilage. The cartilage changes shape in the primary bronchi to a full ring, and changes again to a crescent-shaped structure in the secondary and tertiary bronchi. The trachea starts at the lower border of the cricoid cartilage and terminates at the division into the right and left main bronchi. This occurs at approximately the vertebral level T6, which sits behind the sternal angle. The angle between the right and left bronchi is called the carina. The right main bronchus is shorter, wider, and more vertical in comparison to the left main bronchus, meaning inhaled objects are more likely to lodge in the right main bronchus. The right and left bronchi are known as the primary bronchi, and these divide into lobar or secondary bronchi. There are 3 right lobar bronchi and 2 left lobar bronchi, relating to the number of lobes in each lung. Each secondary bronchi divides into a number of tertiary bronchi, which each supply a bronchopulmonary segment. A bronchopulmonary segment is an area of lung that is supplied by a branch of the pulmonary artery, drained by a branch of the pulmonary vein, and has a tertiary bronchi supplying air. It is possible, if needed, to remove one bronchopulmonary segment with very little bleeding or gas leakage, because each segment is relatively separated from the next. The left lung has 2 lobes, upper and lower, and the right lung has 3 lobes, upper, middle, and lower. The hilum of each lung is found on the mediastinal surface, closest to the heart, and contains the following structures: the main bronchi, the pulmonary artery and vein, which supply blood for gas exchange, lymphatics, and the bronchial arteries and veins, which supply blood for the respiring cells of the respiratory system. One way to remember the number of lobes of each lung is shown on the screen. The letter L needs 2 lines to draw it, so the left lung has 2 lobes. The letter R has 3 lines to draw it, so the right lung has 3 lobes. The lungs have a dual blood supply via the bronchial and pulmonary arteries. The bronchial arteries supply the conducting portion of the respiratory system with oxygenated blood. This blood enters the lungs oxygenated and leaves deoxygenated, as this oxygen supply has been used for respiration. The pulmonary arteries carry the entire cardiac output of the right ventricle to the lungs for the process of gas exchange. This blood comes to the lungs deoxygenated and leaves oxygenated. The venous return is similar but reversed. Bronchial veins return deoxygenated blood back to the heart. Pulmonary veins return newly oxygenated blood back to the heart. The epithelium found in the respiratory system is ciliated, pseudostratified columnar epithelium with goblet cells. Between the nasal cavity and the secondary bronchi, the goblet cells produce and release mucus, which traps microorganisms and inhaled particles. The cilia then waft the mucus up to the pharynx to be swallowed and digested in the gastrointestinal tract. From the secondary bronchi onwards, the goblet cells are replaced by Clara cells, which produce and secrete surfactant that reduces the surface tension of the alveoli to prevent the walls of the alveoli from sticking together during expiration. The bony thorax is composed of the sternum, 12 pairs of ribs, and the 12 thoracic vertebrae of the spine. The lungs are ventilated by the bony thorax, the intercostal muscles, and the diaphragm functioning together. The first 7 ribs are attached to the sternum through the costal cartilage, whilst the 8th, 9th, and 10th ribs are attached to the costal cartilage of the 7th rib. The 11th and 12th ribs terminate in the abdominal musculature. During the process of inspiration, the ribs swing superiorly and laterally, which increases the lateral diameter of the thoracic space. This movement is known as the bucket handle movement. The sternum moves anteriorly during inspiration to increase the anterior-posterior diameter. This is called the pump handle movement because it is a similar movement to the handle of an old-fashioned water pump. There are 3 muscles found in each intercostal space, and they are all innervated by the intercostal nerves. These muscles are, from superficial to deep, the external, internal, and innermost intercostal muscles. The external intercostal muscles are the most superficial of all 3. The fibers from these muscles project inferiorly and anteriorly. The external intercostal muscles are responsible for a portion of chest expansion during unconscious or quiet inspiration. The internal intercostal muscles have fibers that project inferiorly and posteriorly. They are used for forced expiration. The innermost intercostal muscles are the deepest of all intercostal muscles. They are used alongside the internal intercostal muscles during forced expiration and have fibers that travel inferiorly and posteriorly. The neurovascular bundle that supplies the intercostal muscles runs on the inferior border of each rib, meaning it sits superiorly in the intercostal space. This is essential knowledge when inserting a chest drain, a tube that enters the pleural space to drain fluid or infection that is contained there. It is important to place the tube on the upper surface of the lower rib so the tube sits inferiorly in the intercostal space, meaning the tube will avoid the neurovascular bundle. The diaphragm is the main muscle responsible for chest cavity expansion during inspiration. The muscle is dome-shaped at rest, but during contraction it flattens with the muscle moving downwards, increasing the vertical diameter of the chest cavity. The diaphragm is split into a right and a left dome, or hemidiaphragm. The right sits at the level of the 5th rib, and the left at the level of the 5th intercostal space. The right dome is higher in comparison to the left, due to the liver pushing the right dome superiorly. The diaphragm is innervated by the left and right phrenic nerves, which have nerve roots of cervical spinal nerves 3, 4, and 5. This means that if either nerve is damaged, there is paralysis of the affected side of the diaphragm. This can be seen in a chest X-ray, as the affected side will appear as a dome despite the chest X-ray being taken while the patient is breathing in. The phrase C3, C4, C5 keeps the diaphragm alive can be used to help remember the spinal nerve roots that innervate the phrenic nerves. The diaphragm has 3 openings for 3 important structures. These are the inferior vena cava at the level of thoracic vertebra 8, the esophagus at the level of T10, and the aortic hiatus, which allows the passage of the aorta through the diaphragm at the level of T12. This can be remembered by the vena cava having 8 letters for T8, the esophagus having 10 letters for T10, and the aortic hiatus having 12 letters for T12. The pleura is the serous membrane that lines the lungs and the thoracic cavity. The pleura is composed of 2 membranes, the parietal and the visceral pleura. The parietal pleura lines the inside of each hemithorax, meaning it is stuck to the inside of the chest wall. The visceral pleura lines the outside of each lung. The function of the pleura is to ensure that the lungs expand and inflate as the thorax expands during inspiration. Between the parietal and visceral pleura is a small cavity known as the pleural cavity. It contains a very small volume of fluid known as pleural fluid. This fluid allows the pleura to slide effortlessly over each other during the movements of respiration. The pleural fluid also acts to keep the lung inflated against the chest wall because of the negative pressure within the pleural cavity. That is the end of this lecture. Be sure to check out simplemed.co.uk for hundreds of free articles, thousands of free questions, and any support that you might need. Thank you for listening. Goodbye.